Let's start by busting a huge myth right away. Many people think you can tell if someone has a sexually transmitted disease or STD just by looking at them. They believe that if a person looks clean, healthy, and has no visible signs like sores or rashes, they must be safe. This is one of the most dangerous misconceptions out there. The truth is, most STDs don't show any symptoms at all, especially in the early stages. This means a person can have an infection, feel perfectly fine, and unknowingly pass it to others. It's a silent spread that affects millions of people every single year, from all walks of life. This idea that you can spot an STD is a myth we need to get rid of for good. It creates a false sense of security and leads to risky behaviors. People might skip using protection because their partner looks clean. This way of thinking is not based on science or medicine. It's based on judgment and stereotypes. The reality is that anyone who is sexually active can get an STD. It doesn't matter how many partners you've had, what your orientation is, or how healthy you seem. These infections don't discriminate. They are simply microorganisms, bacteria, viruses, and parasites, looking for a new host. Understanding this simple fact is the first and most critical step toward protecting yourself and your partners. Instead of trying to visually inspect someone, we should be focusing on things that actually work, like open communication, regular testing, and consistent condom use. One of the trickiest things about STDs is that they can be asymptomatic. That's a medical term that simply means without symptoms. You might be wondering how an infection can exist in your body without making you feel sick. It all comes down to how these tiny organisms interact with our immune system. When a bacteria or virus enters your body, your immune system launches a defense. Sometimes this defense is strong enough to keep the infection in check, preventing it from causing noticeable problems like pain, discharge, or sores. The infection is still there, living and multiplying, but it's flying under the radar. This asymptomatic state is particularly common with some of the most widespread STDs. For example, chlamydia is famously known as a silent infection because the vast majority of people who have it don't experience any symptoms at all. The danger of asymptomatic STDs is twofold. First, because you don't feel sick, you are unlikely to seek medical treatment. This allows the infection to potentially cause long-term damage without you even realizing it. Second, if you don't know you have an infection, you can't take steps to prevent passing it to your partners. This is how STDs spread so effectively through communities. This is precisely why regular testing is so crucial for anyone who is sexually active. Getting tested is the only way to be certain about your health status. It removes the guesswork and replaces it with facts. Think of it like a routine checkup for your car or your teeth. It's preventative maintenance for your body. Don't wait for symptoms that may never appear. Now let's break down STDs into three main categories, starting with the bacterial ones. The good news about this group is that they are generally curable. That's right. With the right course of antibiotics, these infections can be completely eliminated from your body. The key players in this category are chlamydia, gonorrhea, and syphilis. These are caused by bacteria, which are single-celled organisms that can multiply quickly inside the body. Because they are living organisms, they are vulnerable to antibiotic medications designed to kill them. However, curable does not mean harmless. If left untreated, these bacterial infections can cause very serious and sometimes permanent health problems. This is why early diagnosis and treatment are so important. For example, untreated gonorrhea can spread to your joints and blood, which can be life-threatening. Untreated syphilis can progress through several stages over many years, eventually causing severe damage to your heart, brain, and other organs. Diagnosis for bacterial STDs is straightforward. It usually involves a simple laboratory test. For chlamydia and gonorrhea, a urine sample is often all that's needed, though sometimes a swab from the affected area is used for a more accurate result. Once diagnosed, treatment is typically a course of antibiotics. It is absolutely critical that you take all the medication as prescribed, even if you start to feel better. It's also vital that your sexual partners get tested and treated too, to avoid reinfecting each other. Let's take a closer look at chlamydia and gonorrhea, two of the most common bacterial STDs. They are often discussed together because they share many similarities. Both are incredibly widespread, especially among young people, and both are notorious for being asymptomatic. Most people with these infections have no idea they are carrying them. When symptoms do appear, they can be mild and easily mistaken for something else. Because these symptoms can be subtle or completely absent, many cases go undiagnosed. This is where the real danger lies. If left untreated, both chlamydia and gonorrhea can lead to significant health complications. In women, the infection can travel from the cervix up into the uterus and fallopian tubes, causing pelvic inflammatory disease or PID. PID can cause chronic pelvic pain, ectopic pregnancies, a life-threatening condition where a fertilized egg grows outside the uterus, and infertility. In men, while less common, complications can include inflammation of the testicles, which can also impact fertility. The good news, as we've mentioned, is that both infections are curable with antibiotics. The key is getting tested. The Centers for Disease Control and Prevention recommends annual screening for all sexually active women under 25, as well as for older women with risk factors. If you test positive, it's essential to follow the treatment plan exactly as your doctor prescribes. This is called expedited partner therapy, and it's a critical step in stopping the spread of the infection. It's about teamwork. Ensuring everyone gets treated is the only way to break the cycle of reinfection. Syphilis is another bacterial STD, but it stands out because of its unique multi-stage progression. It's sometimes called the Great Pretender because its symptoms can mimic those of many other diseases, making it tricky to diagnose without a specific test. The infection progresses through distinct stages: primary, secondary, latent, and tertiary. Each stage has different signs and symptoms, and if left untreated, the disease can cause devastating damage to the body over time. The first stage, or primary syphilis, typically begins with a single, painless sore called a chancre. This sore appears at the spot where the bacteria entered the body, such as the genitals, mouth, or anus. Because it's often painless, it can easily go unnoticed. In the secondary stage, you might experience a non-itchy rash, often on the palms of your hands and soles of your feet. Other symptoms can include fever, swollen lymph nodes, sore throat, patchy hair loss, and muscle aches. The infection then enters the latent stage, which can last for years. During this time, there are no visible signs or symptoms, but the bacteria remain in your body. This is a particularly dangerous phase because people assume they are healthy while the disease silently prepares for its final, most destructive stage. If syphilis remains untreated, it can progress to the tertiary stage, which can occur 10 to 30 years after the initial infection. At this point, the disease can damage your internal organs, including the brain, nerves, eyes, heart, and blood vessels, leading to dementia, blindness, paralysis, and even death. The damage done in this stage is irreversible. This is why early detection and treatment are so critical. A simple blood test can diagnose syphilis at any stage, and a course of penicillin can cure it, preventing this devastating long-term damage. Now we move on to the second category, viral STDs. Unlike bacterial infections, most viral STDs cannot be cured. Once you are infected with one of these viruses, it remains in your body for life. That might sound scary, but it's important to understand that incurable does not mean unmanageable. We have excellent treatments available that can control these viruses, reduce symptoms, and lower the risk of transmitting them to others. The main players in this group are human papillomavirus, or HPV, herpes simplex virus, or HSV, human immunodeficiency virus, or HIV, and hepatitis B. These viruses work differently than bacteria. Instead of just multiplying on their own, they invade your body's own cells and use them to make copies of the virus. This makes them much harder for our immune system and medications to eliminate completely. They can also enter a dormant or latent state, hiding inside cells for long periods without causing any symptoms, only to reactivate later. This is why they are lifelong infections. The virus becomes a permanent lodger in your body's system. Diagnosis for viral STDs can vary. For HIV and hepatitis B, a blood test is the standard method. For herpes, a doctor can often diagnose it by looking at the sores during an outbreak, but a blood test or swab can confirm it. While we can't cure these viruses, we can manage them very effectively. For HIV, modern antiretroviral therapy can reduce the virus to undetectable levels. For herpes, antiviral medications can prevent outbreaks, and for HPV and hepatitis B, we have highly effective vaccines. Let's zoom in on two of the most common viral STDs, herpes and HPV. Though both are viruses, they affect the body in very different ways. Herpes is caused by the herpes simplex virus, or HSV. There are two main types, HSV-1, which traditionally causes oral herpes, and HSV-2, which traditionally causes genital herpes. The main symptom of a herpes outbreak is one or more painful blisters or sores. These sores eventually heal, but the virus remains dormant in the nerve cells and can cause future outbreaks, often triggered by stress or illness. HPV, or human papillomavirus, is a different kind of virus. In fact, it's a group of more than 200 related viruses. It is the most common STD in the world. Nearly every sexually active person will get it at some point. Most of the time, the body's immune system clears the infection on its own within 2 years. However, some types of HPV are considered high risk because they can cause cancer, most notably cervical cancer. Other low-risk types can cause genital warts, which are non-cancerous growths. The management and prevention strategies for these two viruses also differ. For herpes, the focus is on managing symptoms and reducing transmission. Antiviral medications can be taken daily to suppress the virus, which makes outbreaks much less frequent and significantly lowers the chance of passing it to a partner. For HPV, the biggest breakthrough is prevention through vaccination. The HPV vaccine is safe and highly effective at preventing infections with the types of HPV that cause most cancers and genital warts. This combination of vaccination and screening has the power to nearly eliminate cervical cancer. Our final category of STDs is caused by parasites. These are tiny organisms that live on or in a host and get their food from or at the expense of that host. The most common parasitic STD is trichomoniasis, often called trich. Another type is pubic lice, also known as crabs. While these infections can be very uncomfortable and annoying, the good news is that, like bacterial STDs, they are completely curable with medication. They are generally considered less severe than many bacterial or viral STDs, but they still require proper medical attention. Trichomoniasis is caused by a single-celled protozoan parasite called Trichomonas vaginalis. It's extremely common, yet many people have never heard of it. About 70% of people with the infection do not have any signs or symptoms. When symptoms do occur in women, they can include a fishy-smelling vaginal discharge, itching, and pain during urination or sex. Men with trich rarely have symptoms. It is easily cured with a single dose of a prescription antibiotic, and both partners need to be treated at the same time. Pubic lice are tiny insects that infest the pubic hair area. The main symptom is intense itching in the genital region caused by an allergic reaction to the lice's saliva. You might also see tiny eggs called nits attached to the pubic hair shafts or the lice themselves. Treatment involves using over-the-counter or prescription shampoos or lotions that are specifically designed to kill the lice. It's also important to wash all clothing, bedding, and towels in hot water to kill any remaining lice or nits. So we've covered a lot of ground. We've busted myths, talked about silent infections, and broken down STDs by their cause. Now let's put it all together into a simple, powerful action plan. Your sexual health is in your hands, and these steps are the best tools you have to protect yourself and others. This isn't about fear, it's about empowerment. Being proactive and informed is the smartest and most caring thing you can do. Let's make this your personal health strategy, starting today. First and foremost, get tested. If you are sexually active, regular testing is non-negotiable. It is the only way to know your status for sure. Talk to your doctor about how often you should be tested based on your personal situation. Second, use condoms. When used correctly and consistently, latex condoms are highly effective at preventing the transmission of most STDs, including HIV, gonorrhea, and chlamydia. Think of it as a seatbelt for your sexual health. Third, get vaccinated. We have safe and effective vaccines that can protect you from HPV and hepatitis B for life. The HPV vaccine prevents cancers. The hepatitis B vaccine prevents a serious liver infection. These are incredible medical advancements that you should absolutely take advantage of. Fourth, communication is key. Talk openly and honestly with your partners about sexual health before you become intimate. It might feel awkward at first, but it's a sign of respect and maturity. Finally, consider your number of partners. Reducing your number of sexual partners can lower your risk of exposure. A mutually monogamous relationship where both partners have been tested and are negative is one of the safest ways to have sex. But no matter your relationship status, these core principles apply. Get tested, use protection, get vaccinated, and communicate. Taking these steps doesn't just protect you, it protects your partners and your community. It's a collective responsibility. Your health is worth it. Take care of yourself and take care of each other.